Hello everyone. Today, we're diving into the world of a medication called Fluticasone Propionate, commonly known by its brand name, Flonase. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Fluticasone Propionate, often recognized by its brand name Flonase, is a corticosteroid used to treat symptoms of allergic and non-allergic rhinitis. It's available as a nasal spray and works by reducing inflammation in the nasal passages, thereby alleviating symptoms such as congestion, sneezing, runny nose, and itchy or watery eyes. Initially approved by the FDA in 1994, Flonase has since become a popular over-the-counter remedy for managing seasonal allergies, hay fever, and year-round, perennial, allergic reactions. Additionally, it can be prescribed to treat nasal polyps and certain other conditions as determined by a healthcare provider. Warnings: Flonase comes with its set of precautions. It is not intended for those who are allergic to fluticasone or any other ingredients in the spray. It is also important to use this medication exactly as prescribed to avoid potential side effects. Prolonged use of corticosteroids can lead to complications, including thinning of the skin, increased risk of infections, and potential effects on growth in children. Before taking this medicine. Before starting Fluticasone Propionate, several factors need consideration. Inform your healthcare provider if you are allergic to the drug or if you have had any recent nasal surgery, injury, or sores, as this might affect the use of a nasal spray. Discuss your medical history, particularly if you have liver disease, eye problems, such as cataracts or glaucoma, tuberculosis, herpes simplex infection of the eye, or any untreated viral, bacterial, or fungal infections. If you are pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider, as the safety of Flonase during pregnancy and breastfeeding has not been fully established. Regular monitoring and consultations with your healthcare provider are advised to ensure the medication is working effectively and to address any potential issues. Side effects: all medications can have side effects, and Fluticasone Propionate is no exception. Some individuals might experience minor side effects such as nasal dryness or irritation, headache, sore throat, nosebleeds, or an unpleasant taste or smell. These are usually mild and temporary. However, there are potential serious side effects that require immediate medical attention. These include signs of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, trouble breathing, severe nosebleeds, painful sores in the nose, vision problems, and signs of infection, such as fever, chills, persistent sore throat. Long-term use of corticosteroids can lead to systemic effects such as suppression of the adrenal gland function, decreased bone density, and potential growth suppression in children. It's essential to follow the prescribed dosage and duration of use to minimize these risks. Interactions: Fluticasone Propionate might interact with other medications. It's important to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Particular caution is needed if you are taking other corticosteroids, certain antiviral medications, such as ritonavir, or certain antifungal medications, such as ketoconazole. Dosage: correct dosage is vital for the effectiveness of any medication. For adults and children over the age of 12, the recommended starting dose is usually 2 sprays in each nostril once daily. Depending on how you respond to the medication, your doctor might adjust this to 1 spray in each nostril once daily for maintenance. For children aged 4 to 11, the typical dosage is 1 spray in each nostril once daily. It's essential to follow your doctor's instructions or the directions on the package if you're using an over-the-counter version. Do not exceed the recommended dose, and consult your healthcare provider if your symptoms do not improve or if they worsen. Avoid: while on Fluticasone Propionate, avoid contact with people who have infections, particularly chickenpox or measles, as this medication can make you more susceptible to infections. Avoid using other nasal sprays or products without consulting your healthcare provider, as this can affect the medication's effectiveness and increase the risk of side effects. FAQ: many wonder about the age restrictions for Fluticasone Propionate. It's generally approved for use in children aged 4 and older for allergic rhinitis, but always consult with a healthcare provider for specific queries related to this medication. It's also worth noting that while Flonase is available over the counter, discussing its use with a healthcare provider is always a good practice, especially for long-term use or in children. Closing: that wraps up our overview of Fluticasone Propionate. commonly known as Flonase. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.